just as a way of introducing this session is about leadership and engagement. And when I thought about this, I thought this is probably one of the biggest challenges we face over the next few years, as well as healthcare and all the other demands we've got in healthcare at the moment. But climate change, sustainability is a massive challenge for us. And then I thought about our speakers. And as I was getting to know our speakers and the people that are prominent in this area, I thought, with these leaders, what are the qualities that they possess? And I was trying to decipher what makes a really good leader in this place. And a few things I've come up with. Look, they've got aptitude and attitude. This is all purpose. It's not position. You don't have to be a CEO. You don't have to be an executive director to lead in this space. The vision is amazing. They have an eye for the short term and the long term, but also the message is clear and the message is consistent. It's the first team approach that I love, that each of us that are involved in this space, there's very few dedicated sustainability officers. We're very lucky and very supported at South Metro to have Bridget and Emma and Adam and Jen in our area. But this is a rarity. We're so lucky to have it. But it involves all of us stepping out of our comfort zone and talking about a first team approach, a one team, a first team. They act quickly and decisively, but they temper this with respect and fairness. And they stay connected with people, but the job we do in this space is hard. Tough decisions have to be made. So the distinction I notice is they keep a lovely distinction between being friends and being friendly. When you say about those type of leaders, you think, God, it's complex, isn't it? There must be amazing people, have lots of training. But the approach they use is very humbling. And maybe I've got it wrong, and they'll tell me afterwards, because I've just been analyzing the speakers today. And I think it's really simple. Firstly, it's all about role modeling. They walk the walk, they set the standard. Their job is to do their job and improve their job, and they do that well. What I love about it, and when I speak to the officers around here and anybody to do with sustainability, is the stories they tell. I see my position in that story. I see my purpose. I see the impact I'm going to make. Then it's the enabling mechanisms, the things that happen behind the scene, what they do to make it easy for us to do the right thing. And that is important. And that may be taking something away, or maybe adding something in there, or maybe putting policy in. And then it's the skills and confidence. It's the ability to put yourself out there, to have a go, to fail fast, and then to go back with even more resilience and learning there. So role modeling, storytelling, enabling mechanisms, skills and confidence, amazing qualities, but we've all got them. Today, you'll hear these qualities shine from our fantastic speakers, and they'll share their leadership stories, their successes, and maybe their secrets, to actually give you some confidence and inspiration to do something for your organization, maybe yourself, and most importantly, our planet. Before I get on to the speakers, I'd just like to challenge you all here. And I know you're all advocates, don't get me wrong, but when you listen to our guys speak here today, can I ask you just to take one point that they say, one message from what they say, and put it into action in your organization. Just introduce it, and maybe having a chat about what you've learned today, but we need to keep this momentum going. Are we ready to get cracking? Yes. All right, thank you. All right, our first up, Kim is online with us. Kim is from STSG Consulting. Kim is a principal sustainability consultant with over 15 years experience in public, private, and nonprofit sector. Kim combines experience in strategy, development, governance, implementation, behavior change to overcome barriers to sustainability. Kim's experience, and this is the important word, integrates climate change into governance systems, part and parcel of our accountability. So please welcome Kim.
Thanks. So today I wanted to present a professional opinion on best practice for integrating climate change into corporate governance systems. And I wanted to do that because if we are going to increase the rate of climate action, we really need to make climate change front and center for our boards and our senior leadership team. The three governance processes I wanted to touch base on briefly are strategy, finance, and risk management. And I wanted to also recognize that as sustainability professionals, we're asking our organizations to create change. So when we go about our work, we need to look at three key enablers of change that need to operate together. And that is motivation, knowledge, and capacity for change. Because if we don't address those three things, then we won't succeed in getting change. So with that in mind, our strategic document is a document for change. It's the document that states the change that we want to make. And so our motivation for that change needs to be crystal clear, and it needs to be personal and relevant to your organization. Now, of course, in healthcare, you've got limited funds and so much important work with asthma, diabetes, cancer. And so you're really going to have to be clear on your motivation and make it personal, relevant. If you want to tackle climate change so that you can actually cure your patients from cancer instead of having them die of a heat wave before you cure them, then state it. It has to be relevant and personal to actually make the change. You also need to go and look at the capacity. And I'd recommend that two big things that you look at for capacity are time. I want you to think about the last time someone in your organization had a good idea and it sat on the back burner because nobody had the time to actually implement it. So actually coming in out with an outline for knowledge and capacity, really addressing time, is incredibly important to make your strategy successful. We also need to look at authority to act. Often we have a centralized sustainability person, and it's great to have that knowledge and that influence, but we also need to share the responsibility across the organization, depending on who's got the authority. For example, facilities maintenance need to have the authority and the responsibility to actually put in sustainable lights, whereas the anaesthetists need to be the ones who have the authority and responsibility for using low greenhouse gas anesthetics. We also need to acknowledge that climate change, greenhouse gas reductions, clashes with business as usual. So you might have objectives that, if you don't plan and put in a risk management plan, are going to clash with your greenhouse gas reduction plans. One thing that I recommend that you do is just a simple risk management approach using a traffic light system to understand when your objectives clash with each other. And then you can come up with a simple strategy for actually managing this. So I want you to imagine that you're a home care service provider and that one of your objectives is to actually grow your reach, which means that you're actually growing your vehicle use and your home visits. So you need to come up with a plan that enables you to do that at the same time that you reduce your greenhouse gas emissions. That could be something as simple as having a salary sacrifice agreement with your staff for hybrid vehicles, where you wait for fully electric vehicles to become affordable. And that will enable you to take steps to implement both objectives. Then if we move across to finance and risk, the best practice and the minimum, what is becoming rapidly a minimum global standard for integrating climate change into financial planning, is the Task Force for Climate-Related Financial Disclosure. So what this task force does is they recommend that you do a climate risk assessment and also identify opportunities around climate change, that you integrate those into your corporate strategy and your risk management planning. And then you go and integrate those into your financial planning, but also integrate it into your organization's existing financial reports. Now, there are a couple of challenges with this. We can integrate future projections of climate change into financial plans, but we need to recognize that our financial reports are short-term and historical. So we really need to sit down with our finance teams and have conversations about how have we already been impacted by climate change. These are a couple of lines out of an actual hospital's financial report. And as you can see, there are things such as insurance premiums going up or loss of insurance. There's increased costs of maintenance. You might have bought solar panels, and so your electricity cost might go down, but the cost of connecting to the grid might actually increase because the grid network has to pay for all the climate impacts and staying resilient with those climate impacts. So these are the kinds of conversations you can have with your finance team. And the advantage of capturing these historical things that have happened in the last few years is it makes climate change real and now, not just something that's going to happen in the future, which means you have a leverage to actually have a conversation with management and to actually get climate change prioritized. The other hurdle that we need to really look at with the health sector is that the TCFD, it was actually designed by the private sector, and it assumes that if you're managing climate change well, your sales are going to increase and your costs of production are going to decrease. Now, we know in the health sector that you might have funding that's capped by government, or you might rely on philanthropic funding. And so as your demand for services increase, you may not actually get extra funding. So the only way that you can really round out this conversation about financial impact of climate change is to develop indicators that talk about how your level of service and how your demand for service are being impacted by climate change, and to actually take these indicators and make them key risk indicators and integrate them into your organization's existing risk register. I'd recommend that the best practice framework available for developing climate indicators actually comes from a group of Victorian councils who had some government funding a few years back to do a study on international best practice for developing climate risk. And they've developed a framework and spent a few years testing a framework for developing indicators. So if you look at the links later on, the framework being government funded is publicly available. And I'll go through a quick example now of the indicators. So some of you might have seen this diagram that I've got up here on the left. And it's a diagram that talks about heat vulnerability. So this is a regional baseline indicator, and it tells us what's changing in the environment that's going to actually change our demand for services so that we can actually plan to manage that. Then there are a few categories about your internal organizational capacity to change. So the first is service vulnerability. A lot of hospitals, well, all hospitals will already go and report emergency wait times, but emergency wait times don't tell us what's causing the change in emergency wait times. If we compare the emergency wait time with, say, heat events, then we can start having a conversation with our organization about what's impacting those wait times, and we can start managing the risk because we know the cause. We also need to look at institutional capacity. So when we have a heat wave, do we have the capacity to actually ramp up and put more staff on to actually manage that load during a heat wave? Budget and finance, do we have the funds to pay for those staff? And then participation and awareness. So when we're doing our planning to work out how much emergency services we need, when we're looking at our processes and procedures, do the people doing the planning and the procedures actually know how our organization is being impacted by climate change so that they can actually incorporate this into our planning and our processes and actually support staff to actually deal with this? So these are the different categories of indicators that I recommend you look at when you're developing your key risk indicators. So in conclusion, if you want to have an organization that's really strong in the climate governance space and puts climate change front and center for your leadership, I recommend integrating climate change into your strategic plan and recognizing as you develop your strategic plan that you need to hit the 3 key enablers for change, which is motivation, knowledge, and capacity. I also recommend that you do some basic risk management around your strategy so that you can come up with a plan when things like reducing greenhouse gas emissions clash with business as usual, and you can come up with something that's actually going to be workable for your organization. Then there's starting to actually report on the financial impact that climate change is having. And of course, recognizing as the health sector that your income's not necessarily going to change based on your demand for service. So really looking at those key risk indicators so that you can tell the story about how level of service and demand for service are being impacted. Thank you.
Thank you so much, Kim. What a great informative lesson and telling us where we're going. Key things I heard from Kim was climate change is real and now, and we should start bringing this into business as usual as quickly as possible. A lot of work to do there, but I think if we just start now before it's going to come soon.